Hello, this is Dr. Keith Miller, former president of the Pennsylvania Chiropractic Association, with an update on Highmark. As many of you know, in past years when you had Tivity as your pre-authorization provider for Highmark, when you did authorizations, every January 1, it was an absolute nightmare in your office. You were required to basically get a brand new authorization. Authorizations went with the patient's calendar year or insurance year if it was like a March to March plan. But when the plan kicked over, the pre-authorization needed to start new. As many of you have noticed and commented over the last several months, the Helion ARC system by Predictal was giving you the pre-authorizations, but then you were getting an expiration date that was getting January 2025, March 2025. And these were essentially dates that we all wondered, is that the actual date? Or was it like in Tivity that regardless of what it said, you had to start over 1/1? Well, we've been asking Highmark this question since maybe September, definitely October, November, and December. And we asked them if they could give us this information before Christmas so all of you and your staff could plan for the first of the year. Well, what wound up happening is that after weeks and weeks and weeks and weeks of asking over and over again, Highmark finally said that yes, indeed, that the authorizations are good for 180 days, and those 180-day authorizations and the dates that you're getting in 2025 are indeed the actual expiration date of that pre-authorization. Now, many of you now have the next question of, well, do I get my automatic number in the following calendar year? And the reality is that we do not know that's going to happen. Is the next authorization, regardless of whether it's a new calendar year, going to be a continuation of it? Are they going to see all care plans moving forward as a single one, especially if it's using the same ICD-10 codes? So we're assuming at this point that it's probably going to be continuations. I do not know if we're going to be getting auto ones on continuations or not. So I'm asking all of you to email or go to the penchiro.org website. There's that insurance section. And as soon as you get that first auth going in to 2025 on an existing patient, please let us know if this is going to be a continuation or you're getting the order numbers, just so we can put that information out to everybody else. And then we can go back to Highmark and have questions or comments about that as well. So hopefully this is good news that you and your staff aren't going crazy the first of the year like always. Below you should see the announcement from Highmark that was directly because of the PCA. Don't forget, the PCA is the only organization in Pennsylvania who is doing this for you. And without this information, without us having these conversations, things would be significantly worse for all of us. We have some great bills out there. Look for the copay bill dropping in 2025. Copays are getting ridiculous. Reimbursements getting lower. More and more you're seeing copays that are higher than the maximum amount of reimbursement, which is not insurance. It's basically just a discount plan at best. So please support the PCA, support a political action committee. That's how we get these bills passed. You can sign on to penchiro.org to make a recurring donation to PAC. If it's $1 a month, if it's $5 a month, if it's $100 a month, every single dollar, 100% of it goes towards political action to pass the bills and the legislation that makes Pennsylvania a better state for chiropractors. We also have the new scope of practice dropping in 25. We've got lots of great things. So happy week before Christmas, everybody, and hopefully this is some good news for you and your staff. Bye, everyone.